Welcome to this short video, which looks at the potential risks caused by vibration at work. Our aim is to provide you with a clearer understanding of the condition known as hand-arm vibration syndrome, or HAVS, and also to provide some simple advice and tips to help you minimize the risks, allowing you to work more safely. Any part of your body can be affected by vibration, but it's predominantly the fingers, arms, hands and back that are most at risk. The risk of damage increases if you regularly use handheld or hand-guided power tools, or machines such as concrete breakers, concrete pokers, sanders, grinders, disc cutters, hammer drills, chipping hammers, chainsaws, brush cutters and hedge trimmers. You are also at risk if you physically hold pieces of work that are vibrating because of the powered machinery being operated, such as a pedestal grinder. You're particularly at risk if you regularly operate hammer action tools for more than 15 minutes per day. And equally, some rotary and other action tools pose a risk if they're operated for more than 1 hour per day. The risk increases if you get cold or wet, as this reduces your body temperature. Gripping too tightly and having poor posture will also increase the risk of damage, as a tight grip transfers more vibration energy to the hand. The greater the area of hand exposed, the greater the risk. The Health and Safety Executive provides guidance on safe exposure levels. It's important that you adhere to these guidelines. If you have any concerns, contact your site health and safety representative. HAVS is the generic term used to describe a variety of injuries to the hands and arms caused through excessive exposure to vibrating tools. HAVS is preventable, but once the damage is done, it's permanent and disabling. So, what are the primary symptoms of HAVS? Nerve damage, resulting in numbness, tingling and loss of sensation. Blood vessel damage, often referred to as vibration white finger or Raynaud's syndrome. Musculoskeletal damage, resulting in pain, stiffness, arthritis, bone cysts, or reduced grip strength. And carpal tunnel syndrome can also be a symptom of HAVS. The most startling symptom of HAVS is a blanching appearance in the fingers and hands, caused by poor blood circulation through severely damaged blood vessels and tissue. If this condition is not detected in the early stages, it can permanently impair blood circulation to the fingers. In most serious cases, it can lead to gangrene and possible amputation of the fingers. For some people, the symptoms may appear after a few months of exposure, but for others, it may take several years. Generally, the longer you're exposed to the vibration, the worse the symptoms will become, although the rate of deterioration will vary from person to person. Let's hear from two people affected by HAVS.
I suffer from very cold hands. They're worse in winter than in summer. Today is a warm day, but my hands still feel cold. I have difficulty picking up things, especially small things, or pushing buttons. I regularly drop things and I can't really sense how much pressure I'm putting on my finger and thumb.
HAVS has definitely affected my day-to-day living. I have a loss of feeling and sensation in my hands. My fingers go white and I find it very difficult to use them. Gripping with my thumbs is very difficult and painful. I can't do many of the hobbies I used to enjoy, like swimming and fishing.
So, what are the early signs and symptoms to look out for? Well, tingling and numbness in the fingers. This can also cause sleep disturbance. An inability to feel things with your fingers. A loss of strength in your hands. For example, you may be less able to pick up or hold heavy objects. In cold and wet environments, the tips of your fingers go white and then red, followed by a painful recovery period. This is a classic symptom of vibration white finger. If you continue to use high vibration tools beyond the recommended exposure times, these symptoms will undoubtedly get worse, potentially resulting in permanent numbness and loss of feeling in your hands, the inability to feel and pick up small objects such as screws or nails, further damage affecting more of your fingers. Nerve entrapment or carpal tunnel syndrome is also a condition associated with HAVS. The nerve that travels down the arm into the hand is called the median nerve. Problems can occur when this nerve becomes compressed and squeezed as it passes through the narrow path or tunnel at the wrist joint. The pressure on the nerve from the wrist causes the fingers and thumb to feel tingly and numb. In severe cases, the patient's fingers and thumb may be incapable of movement or even paralysed. The main symptoms of carpal tunnel syndrome, or CTS, are tingling, numbness, and pain. These symptoms occur in the thumb, the index finger, the middle finger, and half of the ring finger. Whole body vibration, or WBV, is the term given to describe vibration that affects the whole body and not just the hands. WBV is transmitted through vehicle seats or through the feet of employees who regularly drive mobile machines or work vehicles over rough and uneven surfaces. The effects of whole body vibration are generally attributed to driving specific types of construction vehicles for long periods of time. Regular long-term exposure to WBV is associated with back pain, poor posture, and problems with heavy lifting. As there is no specific medical condition relating to WBV, any symptoms of back pain should be reported and monitored by an annual questionnaire. Any further symptoms should be reported immediately. It's your employer's responsibility to protect you against HAVS, carpal tunnel syndrome, and WBV. However, you can help minimize the risks by asking your employer if the work you are doing could be undertaken without operating vibrating tools and machines. If this is not practical or possible, then remember these guidelines. Ask to use suitable low vibration tools. Always use the correct tool for the job. The correct tool will do the job quickly and effectively, resulting in less exposure time to hand and arm vibration. Check your tools before using them. Make sure they've been properly maintained and repaired. Well-maintained tools will significantly reduce the level of vibration caused by faults or general wear. Make sure all cutting tools are kept sharp so they remain efficient. Tell your supervisor if you suspect your equipment is faulty. Store tools correctly. Try to prevent them from having very cold handles before use. To minimize the risk from whole body vibration, avoid driving on rough terrain. Drive slower. Ensure the tire pressure, suspension and seats are regularly checked and well maintained. Please follow any control measures that your employers put into place to reduce the risk of HAVS. Strictly limit the amount of time you spend operating vibrating equipment. Take regular breaks or change your tasks often. Reduce the length of time you spend using one particular tool in one session by doing other jobs in between. Avoid gripping or forcing a tool or workpiece more than it feels comfortable or necessary. Encourage good blood circulation by keeping warm and dry. Wear gloves and warm clothing. Body movements such as shaking your hands and exercising your fingers during work breaks all help increase the blood flow and keep your hands warm. Give up or cut down on smoking. And heating pads and massaging can also help improve circulation. Check your hands regularly and learn to recognize the early signs and symptoms of HAVS. Report any symptoms promptly to your employer or the person responsible for your health checks. Ask your trade union safety representative or employee representative for any advice if you have any concerns. If you're experiencing the symptoms of HAVS, Occupational Health can help you manage these conditions. They regularly administer health surveillance at work, so please ensure that you work closely with them and follow their recommendations. Occupational Health operates a tiered system for checking HAVS. You will initially be asked to complete a questionnaire. The questionnaire will reveal and identify any symptoms you may have. The process is repeated then on a yearly basis. If you have any symptoms such as whiteness or numbness of the fingers, you should be examined by a nurse or doctor. If you notice that your fingers appear white after using vibrating tools, please take a photo on your mobile phone to show the nurse or doctor. If you suspect that you have the symptoms of HAVS, please make an appointment to see your GP. Remember, your hands are your responsibility. Protect your fingers, or you may lose them. If you have any questions about HAVS, please speak to your manager.